letting folks into the call currently. This is Stephen Lard with the Greater Akron Chamber. If you'll bear with us for a moment as we make sure we get folks let into the call. We have quite a few people on the call today, and we appreciate your willingness to come and hear a little bit about what is going on with our health systems and with the work that's being done by our public health group. We have a few different speakers today, and so let me tell you how we're going to proceed in this morning's call. First, we're going to hear from Donna Skoda, who is the Health Commissioner of Summit County. She's going to talk a little bit about the current status of Summit County's response and our experience to date, just some of the numbers and some of the orders that have sort of come through. Then we are going to hear from Dr. Devney, Dr. Hart, Dr. Kent, Grace Kolchek about the work that their individual systems are doing and just get their perspective on what employers should be thinking about right now, some of the issues that they're facing here locally, and how we can be of help in that process. But they'll give you a good picture of what they are managing as each of their systems work to deal with COVID-19. Following that, we late addition to our agenda, Tim Ryan will be on the line, and he will give us a brief update on what's going on in Washington in terms of the package that they are negotiating currently, and give us a status on that. And Mayor Horgan and County Executive Shapiro are also with us, and if they would like to make a comment, we'll give them the opportunity to do that as well. So we've got a full call. Our plan is to be finished by close to 8:30. We may go just slightly over, but we make sure we're getting our system leaders and our elected officials back to their work. So we're going to try to move. With that, I'd like to just update you or provide you just a brief piece of information that might be helpful. Over the last week or so, we've been working closely with a number of our partners that have been involved with the Elevate Greater Akron initiative and leadership by the city and the county, Mayor Horgan, County Executive Shapiro, the Chamber, as well as GAR Foundation, working with almost 20 or so other partners to provide a centralized resource in the community for information and updates, especially tuned towards employers on how they should be thinking about the issues, what kind of resources that they might have available to them. And that website is at www.gaccovid19.org. You're going to find all kinds of resources there available to you, and we'll continue to update that each day as things progress. It's a way in which we can try to sort of reduce the burden on individual organizations of keeping up with all these updates. And there are special links over to different communities that have specific information like the arts or downtown or those kinds of areas. But again, it's an area of resources for you. We're going to try to keep updated as we go through this on a daily basis. And there are also links there to outreach for additional help. If you have questions, COVID-19 at greaterakronchamber.org is a resource for you as well. Our staff is fully connected to that, and we will get back to you as soon as we can if you need help, pointers, resources, referrals, etc. So with that, we're going to move into our discussion today. I'd like to welcome our presenters today for our call. As you can see on the screen, we have Dr. Devney, Dr. Hart, Dr. Kent, Grace Kolchek from our health systems, Donna Skoda, the Health Commissioner for Summit County, Tom Smoot, who is the Director of the Emergency Management Agency, are all here to provide their perspective on what is going on right now, the work that they are doing, and to help us all understand what's happening here locally. I'd like to open up with Donna Skoda. I believe, Donna, you're on the line, and if you want to unmute your microphone, Donna, and if you've got video capability, feel free to open that up as well. But maybe you can provide us a quick snapshot of what Summit County's experience has been to date, maybe some of the numbers that we're seeing right now and the different orders that have come across, and how we may be tracking in Ohio versus other parts of the country or the world, how Summit County is faring. So Donna, are you there? Okay. Donna and Tommy, I know you're together there. I don't know if you are able to hear us. Okay, so Anna, if you would do me a favor, and I will text you their cell phone number. If you could call them and see if we can troubleshoot their connection, we'll move to talking with our system leaders, and then we'll come back to Donna in this process here. So, as all of you look at this and lead your systems in this effort, can you give us a sense of what you're experiencing right now? We hear a lot on the news, and we hear a lot about what is happening in our health systems, but we'd love to get a perspective on what it is that you're seeing, and what the status is on the ground in your organizations. Maybe I'll start with Cliff, since you're sitting here at the top of the list of panelists, and if you want to provide us some perspective, Cliff.
Great, thanks very much. First, what I would like to just put out is that we're pretty lucky here in our community that all the different health systems, the government officials, and the folks from the chamber, everybody has been communicating from early on and been cooperating and really working together in coming up with standard ways to address how we're doing things. I would say we're also pretty blessed in this community just because of the resources we have and the quality of the care. So people have been practicing or getting ready for the potential surge for probably over a week. I would say the biggest issues we've been dealing with, which are in the public, have been the frustration of getting the ability to actually do more broad testing, but we do have the ability through the Ohio Department of Health to get some testing. We have shut down essentially all of our elective surgeries, procedures, testing, those kind of things. So we're operating at about 50% of our normal operations when it comes to that. Labor overall, we've got a lot of employees that are really pitching in and kind of running into the fire. But what we're also finding is we have a lot of people that have been displaced or their operations have ceased because of all of the different community mandates. So we have a labor pool of about 350 people that we're redeploying. We are doing temperatures at each entrance. We've restricted visitors, and we've really, in some sense, we're learning each day how to operate differently. We only have one active patient in our ICU with COVID. We have about 12 people that are under investigation. Early on, it took about 6 to 7 days to get testing. We now can get the testing results in about 24 hours through the Department of Health. SUMA should be able to do our own in-house testing by the end of next week because of the ability to set that up. And then the last thing is that is having the protective equipment. Right now, we're in good shape. We probably have about 2.5 to 3 weeks worth of equipment on our current burn rate. We've been using a lot of other ways to acquire that, but right now we're good. I'll stop there. Maybe Brian go.
Yeah, can you guys hear me?
Yes, we can hear you, Brian.
Fantastic. Had a few AV problems early this morning, so appreciate the chance to speak to all of you this morning. Like Cliff, like SUMA, we've been doing a lot of planning and hearing a lot of concern from both community and our caregivers. The Cleveland Clinic actually has a command center up at the main campus that they activated about 2 months ago in anticipation of a possible pandemic. So in addition, I think, to having great health system leaders and state and government leaders, I think we're also, at least on the Cleveland Clinic side, blessed with having a couple months of planning to start thinking through how we would implement some of the things that we see coming. And we've done so in the last couple of weeks and with our partner hospitals at Akron General. Like Cliff, one of the great frustrations I think that all of us are going to share is the lack of testing. The clinic was able to finally stand up its own in-house testing on a limited basis about a week and a half ago. They did that initially with UH. We've seen about 3 to 4% of those tests come back positive. Now, it's a little hard to know how to interpret that because to get a test required an order, and it's not clear what the population that was tested looked like. Over time, we've limited the tests more and more to older patients at high risk and with chronic medical illnesses, and so that percentage has gone up a little bit. But we've been routinely getting about 20 to 30, give or take, over the past 3 or 4 days, and that has not actually increased dramatically, at least not yet. But we are getting about 3 to 4% of the patients that we test through the various settings positive for COVID. We have had some hospitalizations. The caregivers are, of course, anxious. Dr. Devaney mentioned the challenges with making sure our caregivers are both using the correct protective equipment and making sure that we have enough for the long term, because the hard thing, I think, message both internally and externally, or one of the hard things, is that this is exponential, right? So today's trickle isn't just a little bigger trickle, tomorrow isn't a little bit bigger trickle after that. Today's trickle is tomorrow's river, is the next day's tsunami. Some of these patients can be quite sick. We've seen about, give or take, again, understanding that we're only testing now patients with significant symptoms or risk factors. About a quarter of them are being hospitalized, and about half of those in the ICU. We've done a lot of work on cohorting at Akron General. We are actively in the works of expanding our critical care bed capacity and working with Akron Regional Hospital Association on other kinds of capacity planning for a bigger surge. And I would sort of also say that I think all of our health systems have been very attuned to the impact that this has on the community, on employers, on employment, and trying to keep our caregivers both engaged and employed throughout all of this. We've wound down, all of us have wound down our normal hospital operations in many aspects, outpatient, obviously operating room by the governor's mandate about a week ago, and that plus the cutting off of visitors makes the hospital kind of an eerily quiet place, much more so than we're used to. So there's a real tension, but I also think it's fair to say a real determination. And then on the outpatient side, trying to move as much of our practices towards virtual visits as we can. So that's what we're seeing on the Cleveland Clinic and Cleveland Clinic Akron General side.
Thank you, Brian. Appreciate your leadership. Grace, you want to talk a little bit about what you're seeing at Akron Children's?
Sure. I do want to reiterate what Cliff said about the team of CEOs and public and private folks who have been working with us on a daily basis. We've been on a call every day talking about issues that we can address as CEOs, as the Summit County Health Department, et cetera. It's been really amazing. And to me, I just want to reiterate to me that that's what speaks about, this is what Akron is all about. And we've had the support of anyone and everyone that we needed to get the work done that we're doing. But at Akron Children's, we are pretty much in the same position as Cliff and Brian described, with the exception that we have not had any positives. As you've read in the literature or many of the stories that you're being bombarded with, it seems for some reason that children are being somewhat spared, although we believe that they are just spreaders of the disease, not necessarily being as acutely ill as perhaps our older adults are in the community. So we have not had any positives. Our staff has been absolutely amazing. But you know, they're concerned. They have young families or older families at home. And so we want to make sure that we have put into place the PPE and the protections that we need to make sure our staff is appropriately prepared to take care of patients and that they're protected. We've been working also with the folks about a surge plan, because since children we don't anticipate them to be as affected, we're looking at how we can pitch in and help meet the need of some of our adult partners. So we've got a great team working on that as well. Again, for us, the issues are lack of testing. We are in the same boat as Cliff is, and that we will have our testing up within the next week or so here, but otherwise we're dependent upon sending those out. And so that does have some time delay. PPE, visiting. We are a little bit different here. It's very hard as a children's hospital to limit no visitors or one visitor. Some of our area hospitals are doing. We are still at this point trying to allow 2 caregivers, parents, to be with children. That said, our volumes, as Brian described, are significantly down. Outpatient visits are down 50%. Our ORs are down 80%. And we do have a lot of staff, as Cliff indicated, in our labor pool. So great spirit there. They are doing whatever it takes to help this hospital get through this time and treat our community well and treat our patients and families well. So we have folks, even physicians and providers, who've been reassigned to maybe take on telehealth duties or screening or wherever we're needed in the labor pool. And so I'm really happy that we've been able to make sure that we keep people employed and who go into the labor pool and continue to support the economy in that way. But things are going very well at Children's, and I'm really proud of the staff, the providers, and the employees, and how they're pitching in to make sure that we do the right thing for our families and the community.
Thank you, Grace. I appreciate that. Dr. Kent from Western Reserve.
Well, good morning. We're seeing very similar things as other health systems, but as Grace and Cliff mentioned, this is truly a team effort. You know, the logos are gone. This is about the community coming together. The hard thing for people to realize that are not in healthcare is that they see that there's not a lot around them. But what we're trying to educate people is the tsunami is coming. We've seen it in Italy, we've seen it across the country, the world, and we have to be prepared. We sent home 400 workers to work from home last week. So we're restructuring how our operations are working every day. And the biggest thing is trying to educate the public about what things to do and what things not to do. So hopefully a little bit later today, we'll talk a little bit about the employer groups, making sure they understand what role they play to make sure that we can keep the workforce healthy and at home if all possible. You know, we're seeing the same things here at Western Reserve. We have no visitations here, trying to protect our patients, limited our outpatient services, and really trying to educate our outpatient physicians how to take care of things. In the past, we used to send people in for fever and stuff, and right now we're trying to educate people if you have a fever, the best thing you can do is stay home. Sometimes the worried well, which people that actually have very few symptoms want to be seen, sometimes can put themselves at risk. And we're trying to educate the public to do the best we can to actually stay home, because that's how they stay better versus coming to the hospital, which is not intuitive in the past. So I can tell you that, you know, where we're coming from a health system standpoint, it seems eerily quiet. But as the storm continues to rise here, we need to stand together to make sure we can stay healthy, because our PPE, our personal protective equipment itself, is at small quantities. And right now we need to protect those opportunities. So that's all I have here.
So before we jump into some specific questions for each of you around the status and the work, I think we've been able to get Donna Skoda and Tom Smoot on the line as well. Donna, do you want to provide just a perspective from your role as the health commissioner for Summit County in terms of where you see we are versus other places, and some of the things that are important to relay from your perspective on this? Donna?
Yeah, good morning. I hope you can hear me now, correct?
Okay.
I hope.
Yes.
Okay, great. Thank you. Yeah, I just want to give some points, and I apologize now. I'm just going to kind of answer the questions I was given for the sake of time. So I'm just going to try to be very pointed in the answers to just try to give you the updates. First of all, we have locally, you know, the governor has indicated probably 8 or 9 orders now that have allowed for social distancing, you know, closure, shuttering of businesses, essential services only, stay-at-home orders. Locally, we have added 2 additional orders. We completed one that allowed governmental entities to sort of meet remotely and not have to be in the same room together, as well as be able to vote electronically. And so we've kind of said, let's put the sunshine laws on hold for now, but we have to make every effort in that order to try to include the public, but it is not mandatory. The second order I issued yesterday was social distancing in businesses. We were getting a ton of reports that, like the Walmarts and the Kmarts and everybody who's open, were allowing large groups of individuals to congregate in the stores. That is not what we want. I know folks are really bored, but they're bringing their whole families and they're congregating in aisles. So we have issued orders that mandates they do cleaning and wiping off things, and that they have to socially distance and queue customers into the store and not have this be like a social event now since they're bored at home. I want to be very clear in what I say next, in that is community spread is happening. This is not in any way, shape, or form currently related to people who have been around sick people or individuals who have been in another foreign country or who have traveled. We have it occurring among us now. We've had our second patient in a long-term care facility test positive, which is concerning because if you have followed the Washington news at all, you know that it is very deadly in those environments, as well as very easy to spread to both healthcare workers and the other residents. The numbers are probably very confusing to people. The Ohio Department of Health is only confirming with us data 3 times a day now. They are updating data 3, 5, and 7. Pregnant women are now considered high risk. Their ongoing, the community spread at this point is considered global. And I think we have to be very, very careful in our thinking. I really fear that we're thinking this is like, okay, we'll close the businesses, we'll close the schools for 2 days, 3 days, 4 days, 5 weeks, and then we're going to open everything back up. And I can assure you, if we do that without adequate testing and adequate resources, we are going to have more than a tsunami. It is going to be horrible, and we will see a lot of death. So we have got to be in this for the long haul. And I know it's inconvenient. I know it's economically devastating, but we have got to pull together and think very differently about how we live day in and day out. Let me give you a few numbers. We have confirmed cases as of yesterday in Summit County at 29. The state reported 490 cases across the state. They had reporting 3 deaths. This morning they are reporting 6 deaths. Age range of the persons in Summit County is between 21 to 83. They're all, average age is about 49 years of age, and it's equally split between males and females with a few more males. So I guess and I know that the last thing I'm supposed to address is this business order, essential operations only. And I want to talk just a minute about this order. I think it's difficult for businesses. We've probably had yesterday and it went into effect last night, this morning early at like 11:59 it went into effect. For many, many, many disgruntled. We had about 186 calls in the first 2 hours. Over the course of the day yesterday, we had about 400 businesses reported essential, non-essential. So we have teams out deployed making sure that non-essential is shutting down. And if they are essential, that they are practicing all of the social distancing, any sort of disinfecting, that they're cleaning, and that they're allowing their employees to stay home if they are ill or symptomatic. We are not going to be able, and I think it was Dr. Kent who said, we have to educate the public about, staying home, taking care of yourself, and not spreading the disease. But that's difficult to do for some employees who, if they don't work, they don't get paid. That way they don't have those dollars. So we're working hand in hand very closely with businesses to try to see what we can do to help them be successful and get through this. But I just think we have to start thinking very differently as a country, as a state, and I think our state has. Governor DeWine has tried to get out ahead of this because we are tracking like everybody else. And it isn't, as Dr. Hart said, a trickle coming. It will be many, many, many more people in a tsunami. So those are sort of my comments. I do have hope. I mean, we do have a fabulous healthcare system. We are a mecca of quality healthcare. We have cooperation, we have collaboration, and we have everything we need. We just have to really get the community to buy in that this is important, that we socially isolate, we socially distance, and we try to do everything we can to prevent the spread.
Commissioner, you had mentioned something in your comments that I wanted to just clarify. You said you had companies calling in reporting on essential, non-essential. Are companies supposed to be identifying themselves as essential resources or anything like that?
No, a few companies have, these were mostly disgruntled employees. Basically, I have had a few employees reach out to me and say, they're requesting that we're going to shut them down. Like one of them makes tubing for hospitals, like plastic tubing. We're not going to shut them down, okay? Right. And so we're not going to. So a couple have reached out at a legal level and have asked, can we stay open? Are we essential? But most of this that we are receiving are the disgruntled employees that don't want to be at work and think their employers are treating them badly. So we are trying to get out and work with those groups to make sure. Because, if you're at a call center selling a product, I don't know how important that is at this point in time. So these call centers are probably a lot of our biggest problems because they all sit so closely to each other and they won't let them go home. But I'm not so sure anybody's entertaining a call right now. Do you want me to come fix your driveway or paving or your gutters or your So that's been the biggest concern, and that's where we have folks out really trying to monitor and educate and provide resources to these folks so that they can be successful. We don't want to drive our small businesses out of business. Nobody does. And we will do everything in our power to try to help them.
Commissioner, thank you very much. So for our system leaders, I guess I wanted to ask, we had a question that came through here around the capacity of our ICU beds. You had mentioned, I think a couple of you had mentioned this idea of a surge. Can you talk about sort of where our capacity is right now, what we have the capacity to do, and what we're expecting, and how you are planning on dealing with some of that excessive capacity?
So Cliff here. So one of the things that under Grace's leadership, she's the current head of the Akron Regional Hospital Association, is we are keeping an inventory of all the ICU beds, all the ventilators, and what's available. As many of you know, we normally are all pretty busy just with regular healthcare, but we've been able to reduce numbers across the board. We also have in our community what's called ECMO, which is the ability to have heart-lung machines. So when somebody's really having a hard time on a ventilator, we have the ability to put them on a machine, and we have a pretty good capacity of that in this community. So we've got lots of capable critical care doctors, critical care nurses. We have the beds, we have the ICUs, and I think it's a mathematical exercise, but I think we have the ability to expand in other places. So right now, I think we feel like it's adequate. I think it actually put out numbers as to what we think it's going to be, and create anxiety probably isn't productive. But we've got a significant number compared to other communities, and that's probably the other issue. Is there are communities that don't have as much capacity as there is in Akron. Brian or Grace, Rob?
Yeah, I think, of course, I agree with everything Cliff said. I think there's a few ways to look at the capacity issue. One is, where can we add hospital capacity? So, and I didn't read the details. For instance, Governor Cuomo, New York, issued an order to hospitals to expand their capacity by 50%. I didn't look at the details, but that's to accommodate more patients. Specifically, though, the ability, because when these patients do poorly, they do so from a breathing standpoint. So those patients need to be in a critical care setting, and so we've inventoried within the Akron area and within the Cleveland Clinic system what our ICU, not only what our current inventory is, but also where we can repurpose existing hospital beds to become ICU beds. And you can't do that for all of them. The space has to be big enough. You have to have monitoring, and of course you need the other things that ICU care requires. Cliff mentioned ventilators, which is one of the big rate limiting steps, but also critical care nurses, enough of them, and again, enough PPE, enough critical care physicians. So all of those logistics are underway, and at Akron, and because we've wound down some of the other operations of the hospital, we do have some flexibility. We can turn surgical recovery beds into ICU beds that fairly easily, and then some other parts of the hospital as well. So we've ramped up that capability at Akron by almost doubled, at least by the end of this week, what we will be able to have from a critical care standpoint.
Thank you, Brian. I think that we're fortunate to have the system density that we have in the region here, and that will help us a lot as we go through this. One of the questions I wanted to ask, and we're getting a lot of questions about, is PPE, the supply of PPE, the way in which our employers might be able to help with that. We have employers wondering if they can get access to PPE for their associates in their essential business. Tom Smoot, I know you're on the line. I know you're very involved in this sort of response to the PPE needs of our systems. Do you want to make a comment about that for us in terms of what you're seeing? And then to the hospitals that are on the line here in the systems, are there things that employers can be doing to help you with this, and how do we coordinate that support? Tom?
Yes, thank you, Steve. So yes, that is probably one of the most critical needs right now is PPE. And that is also for first responders and hospitals. We're seeing a worldwide shortage because this is, of course, a pandemic. So these are very unusual times where you cannot get access to your traditional supply chains. So we're seeing, lots of orders, going unfulfilled, or there being very long lead times. We're talking months to be able to get your normal supply of order that would come within a week or so. So one initiative that we have, and what I'd like to ask everyone else if you could assist us in this initiative, is we're reaching out to physicians dentist office, veterinarians, construction companies, those that may have personal protective equipment, and we're asking them to donate those to first responders and to our hospital, our healthcare workers. And we're looking for N95 masks, medical grade nitrile gloves, surgical masks, face shields, medical gowns, and sterile swabs, thermometers, things like that are really essential that help us to carry on our work.
So Tom, is there a list of these items somewhere, or if folks want to help or think they can provide some of this support, how do they find out what they can provide and where they send it to?
So for Summit County, so each EMA is doing things a little different, so you want to make sure if you're in Summit County, you'll call the Summit County COVID-19, this is the public health line. There are 330-926-5795, and then you'll be directed to the drop-off location.
Great. And I know that some of this information, everything that we're doing today is being recorded, so it'll be available to you. But after the call, we're tracking some of these pieces of information. We'll make sure we get them out to folks as well who are on the call and to others. One of the questions that came in around PPE, are we starting to see distributions from the strategic national stockpile to our region at this point? Are you starting to see that flow now?
We received notice last night that the stockpile was coming. This is Donna Skoda.
Donna, I'm sorry.
And so we're hoping that today we have folks down there at our drop site right now. We're hoping that we can start getting through it and getting it out today.
Steve, this is Dr. Kent. I just want to mention to the question earlier about the employers with masks. I guess what I want to reiterate is if you're an employer and you think your staff needs a mask because they're potentially sick, you need to send them home. Masks in employer groups really shouldn't be needed because they're not high risk. And the fact that there's any question about the employee being sick, you need to send them home.
That's great. Thank you, Dr. Kent, for addressing that. Any of the other system leaders, Dr. Devaney, Dr. Hart, Grace, that want to address the PPE issue or your perspective on how employers can help with this?
Grace, you want to talk about what standards we're putting in place?
About the standards? Sure. So we have a group, first of all, before I go into that, Cliff, I just wanted to say, based on what Dr. Hart mentioned and an earlier comment, that I think the best thing that you can do to keep our healthcare workforce healthy is that if you have employees or you yourself are sick, to stay at home and not go out unless you absolutely have to go get gas or food or groceries, because every time you go out and encounter someone who's a healthcare worker, there's a potential to spread the coronavirus, and we really will need all of those folks, doctors, nurses, to be here and be healthy to help manage this. So please do stay at home. That will help prevent the spread. As far as what Cliff was talking about, every day at our call, we have a report out on PPE. We have a great team working on PPE standards so that as people go from hospital to hospital, whether they're practitioners or a patient or nursing staff, they will see the same standard use of PPE based on the CDC guidelines. The confusing part is that changes pretty frequently, and we have a limited supply, and so we're looking at providing the same kind of direction of what masks should be used when, for what kind of employee, for what kind of patient, and we're trying to standardize those across the hospital systems in the area based upon the CDC guidelines. So as you can imagine, trying to communicate that from our group, our small group that's working on this, our incident command groups working in the hospital down to the front line, and things are changing every day. Things get a little bit confusing, but we really do try through, like we're doing through our labor pool, having someone go out and everywhere that staff are wearing PPE to kind of constantly educate based on the most recent standard what they're supposed to be wearing. So we're looking at using surgical masks where we might have used N95s in the past, but it's all based upon best evidence that we have from the CDC and any guidance that we have from Summit County Health Department, governor, etc.
Thanks, Grace. As we're talking about the workforce, two questions I've heard a lot from people. We know we have to protect our healthcare workers because they're so critical, and we're in the beginning of this process. We understand that. What has been happening in terms of, I know you all going into this had difficulty finding workers. Are you seeing two areas, one on childcare for your workers, What is it that you are doing to sort of help support that? Are there ways that we can be helpful in that regard? Or is that a sort of a closed system of support that you're sort of creating in your hospitals? And secondly, anything on the workforce shortage side? I'm not sure there's immediate short-term issues to that, but I just wanted to get your sense of both of those things.
So this is Brian. I'll try to tackle that. We are setting up childcare at our health and wellness centers in small groups with signups. What we've really had though is a lot of just partnership amongst our employees saying, I'm working today, I can watch your kids if you can watch my kids tomorrow. There's been a lot of that going on both formally and informally, and that's been incredibly gratifying. We expected when schools were canceled, or I should say classes were canceled for this time period, to see a lot more call-offs than we actually have. And so it's been very gratifying that both through the hospital and through social relationships, folks have found ways to get their kids taken care of in a safe environment. In terms of the workforce right now, because we've wound down so much of our outpatient and operative and procedural operations, we're actually looking at, or we have created an internal labor pool so that we can deploy folks into different roles. And there are different things that are happening. So all of us have mentioned before about visitor screening. We're also all doing temperature checks at all of our entrances. And so while we don't have as many entrances before, we've been able to repurpose people to do things like stand guard at the employee entrances, so to speak, or stand guard at the entrances and ask screening questions and do temperature checks. But we're not concerned at this time yet about a labor shortage. Of course, getting back to the PPE issue, a substantial concern is that if we can't keep our caregivers safe in this environment, then a whole lot of unpleasant things are going to happen, only one of which is a labor shortage, particularly in very skilled areas, again, like critical care nursing.
Hey, Steve, just real quick, is that child care workers can apply, and the local Y has applied and has 4 pandemic child care centers, and so there are certain requirements for that. And so Jill and all of her folks have done a great job with that, and they're looking at actually expanding that capacity. So some of our workers have been able to use that, but also other folks. And I think that is another thing we should be looking at if people are looking for childcare.
Great, thank you, Cliff. Appreciate you mentioning that. So one of the things you brought up, Brian, was related to temperature checks, and I've got a number of questions on that. Can employers require employees to, do temperatures when they come in? How do folks, manage this temperature taking process in their businesses? And then there's also shortages, it feels, of thermometers. So I don't know, Donna, if you've got perspective on that or can give some guidance on how employers should be dealing with temperature checks.
Well, there is a shortage of the temperature check, the thermometers. And we have some we've been trying to get out to businesses, and we're in the process of looking at purchasing some of those. The thing is, the bottom line is you either have a thermometer or you don't. We've been asking everyone to check the temperatures of their employees as they come in the door. And then ask those questions. Are you sick? Do you feel well? That kind of stuff. If they do not have thermometers, we're recommending that they do have their employee do self-monitoring at home and report that temperature. And we all know that's wide open for abuse. But I think we're pleading to our employees in our businesses to try to get the temperatures taken. And then if, in fact, they do not have the ability to do that, they have their employees do self-monitoring.
So
this is Grace. I just wanted to add that I think one of the other things that the businesses could do is have a paid sick time policy so that employees who are sick know that they will still be paid to stay home and come to work because they need the money.
Thank you, Grace. I forgot that part. Yeah, we are heavily encouraging that there is paid sick leave, or that just let people go home on any time and pay them so that they feel comfortable being at home.
And I know that's very hard for the employers financially, but you have to look at the big picture, because if you don't do that and they come in with sickness and they get 8 more workers sick, you're worse off.
Yeah, that was exactly the point I was going to make. The cost of the sick leave pales in comparison to the cost of what can happen to your entire workforce if you don't take action on it. But I just wanted to make sure that we're clear on this. Employers have the ability to require temperature checks of employees coming through the door for work. Is that correct?
Correct.
Thank you. So we've tried to address questions as they've come across here. I wanted to take a moment to pivot here to Congressman Ryan. Congressman, you have been working with your colleagues in Washington on trying to create measures for relief for our communities and for our employers. Can you give us a brief update, maybe 3 to 5 minutes or so, of what's going on in Washington right now, what we can expect to potentially see happen over the next few days, if you dare to predict, and just give us a sense of a perspective from your view. Congressman, you might want to unmute your line. Anna, can you help the Congressman maybe unmute?
Yeah, it looks like he may have had some issues with connecting, and so we'll see if we can't get him back on the line.
Okay, and Congressman, you might try turning the video off and just using the voice. That helped me stabilize some of my internet issues. But let me just turn for a second. I know Mayor Horrigan and County Executive Shapiro are on the line. I just would invite you, if there's a perspective you want to bring outside of what's been shared already, we'd be happy to hear from you. Again,
can you hear me okay?
Oh, yes, we can. Go ahead.
Hey, thank you. First, I'd like to echo the sentiments of all of our healthcare system leaders. I think there's been an unprecedented level of cooperation in trying to address this, and I appreciate the conversations and the leadership each and every day. Obviously, we're following the strict guidelines as put forth by Donna and Dr. Acton and Governor DeWine, and we separated or furloughed about 600 people last week. The social distancing, all of us, if we can, are working from home as much as we can. Zoom has gotten real popular, so all of those different things we've implemented, and I've made a pretty strong commitment to, you know, we're gonna keep essential core city services going. So we have a significant number of public works people out there who are still doing those things, keeping water on, not doing shutoffs, keeping as many people as employed as possible. A real concern is around public safety and their exposure. And so, you know, unfortunately, I think we're all in this competitive model of trying to track down these masks, which I don't think is healthy. But, you know, that part, I don't think we're doing bad with it, but we could always use more on that end. And so we've even gone through the quarantine separation area if first responders are exposed and not necessarily can't go home. We're working through that. We're working through the legal side of it, of being able to take temperatures. We've been doing it for about a week, a few of them, but it'll be pretty standard across the board, where every employee that has to report to work will take their temperature either at home or we'll take it right at work to do that. So like I said, we have a daily call with the governor about 11:30. If there's anything that we can continue to push stronger and harder, I know you guys are in strong contact with them too, in a lot of contact with County Executive's office and public health. So I would say let's just keep that part of it going. But if there's something that we can push on that call, because I think the governor's been fairly amenable to doing some things that we want and that we need, and they're kind of across the community. So keep those up. And we put out a short video last night and early this morning around this and asking for, you know, a level of compliance and cooperation with the order. We're getting those calls from businesses too. Can I stay open? And obviously we're referring them to the order. And even as the governor said, it's you know, he was kind of tired of just suggesting that this should be done, and came out with the order to make it effective just a little while ago too. So I appreciate the leadership that has stepped up, I think, pretty strong in this room. So thanks.
Mayor, thank you. And I think it is important that the mayor points out that if you have issues, you have concerns, you have questions, again, we have an email available for you at covid19@greaterakronchamber.org. There are other places you can reach out to that Donna has mentioned, others have mentioned. Feel free to use those as well. But to the extent you don't know where to go with a question or an issue or a concern, please feel free to come our direction. I think we may have audio for Congressman Ryan at this point. So Congressman, are you able to sort of provide some thoughts? Congressman? Okay. County Executive, I don't know if there's anything else that you wanted to add to this conversation before we open for additional questions. I feel like I need to say caller here at this point. So sorry about this, folks. Great. Well, I think if we don't have the congressman, just want to try one more time to see if our team can get a hold of him. I thought that we had a connection, but maybe we don't. So a couple things I'd also like to mention. So if you're a smaller business or mid-sized business at this point, there is the Economic Injury Disaster Loan Program through the SBA that is available to companies. There are links for that at the GACCovid19.org website, and that is probably the single largest lifeline at this point available for businesses until we see something come through Washington in terms of additional support. And so these are loans up to $2 million that have up to a 30-year term. And are loans at a low rate of interest that are available to help companies get through this this period of time. We would highly encourage you to take a look at those. There are links on our website to that information. There was a question that we had received, and I don't know, maybe Commissioner Skoda, if you could answer this. A small business owner that is a sole proprietor, has no employees, but has a place of business outside of their home, asking if they're allowed to go to that office to continue their operations if they're the only ones there. My sense is that I'm not sure exactly that has been contemplated, but any thoughts on that?
Yeah, I think that's fine. If they aren't letting a bunch of people in there with them, and if they're going there and doing their work, if you are one of the last remaining shoe repair shops and you're there by yourself and you're fixing people's shoes and you're not
Right.
letting a bunch of people in, that is fine.
Okay, thank you.
Can you hear me?
Yes, we can hear you. Congressman Ryan, welcome.
All right. Sorry about that. I appreciate it. You mind if I take a couple minutes?
Yeah, no, 3 to 5 minutes, if you will. Give us a brief update on what's going on, maybe take a question or two. Go ahead.
Yeah, so just first, thanks to Steve, thanks to the Chamber for doing this. Thanks to everyone who spoke. I think, like the mayor said, and Eileen, I'm sure agrees, we're very, very lucky. We feel very blessed to have all of you on the front line. And please tell all of your workers how much we appreciate it. We're getting a lot of emails too and calls to the office around the PPE issue. And so we appreciate them going to work every single day. So first, let me just give you a little background. So last night, it sounds like the Senate is working on a third relief package. We're not exactly sure of all the details. They're going to be released this morning. The House Democrats released our plan last night. It's looking, obviously in two buckets. One is the public health side, and one is the economic impact side. So on the health side, you noticed in the last package that we passed. I know Donna was talking, and I think maybe it was Grace talking about people that are sick staying at home. And so we provided 80 hours of paid sick leave. We increased family and medical leave. We're going to try to continue to expand that in this next package to make sure that if people are sick, they can stay home. It's amazing to look at what's happening in the country now with all of these kids staying at home. So we're going to try to address that the best that we can. The issues in the Senate right now is there's a huge $500 billion package for businesses, and we're trying to get some restrictions on that so that, in a few months, we don't see golden parachutes for CEOs. We don't see companies like the airlines doing stock buybacks. We want to make sure that this money we get to these companies to stabilize the economy is being used for the appropriate thing. So we're trying to increase the national stockpile. We're putting billions of dollars. I think in the House bill we're shooting for $150 to $200 billion for hospitals, community health centers, and government programs. There's also going to be cash infusions. It's looking like it's going to be somewhere between $1,500 and $2,000 for an individual. Could maybe be up to $7,500 if we can add in couples and then kids. There's $60 billion in the Democratic plan for schools and universities and dealing with student debt and all of the economic impact that people are facing. Money for small businesses. I think we're also looking, in addition to the $150 billion for hospitals, looking for about another $80 billion in very low interest loans. So this money, as you talk about expanding and increasing ICU beds and all the rest, that we can try to get some money pretty quickly out the door to you, at least as quickly as the government can. We've been in contact with Sarah Metzger, who many of you know. We did a call last week with some of the people on this call here, with Brian and Dr. Kent and Cliff and others. We will continue to be available to do those calls. Many of you have my cell phone number. Please know that we're here, and we need to hear from you, because as you communicate with me and we start to put this package together, there's going to be another stimulus package. We want to make sure that we hear from you. Today, just so you know, I'm going to be initiating a piece of legislation. I don't know how much traction it's going to get, but as you know, we've convinced the president to enact the Defense Production Act to start mass producing some of the PPEs that we need. We don't need to have a discussion about how we should have been doing this a couple months ago, but he enacted it last week, but he hasn't used it at all. I've got a bill coming today that's going to require the production of key equipment, 500 million N95 masks, 200,000 ventilators, 20 million face shields, 500 million gloves, 20 million surgical gowns. And I know, there's a lot of people that think those numbers are high, but as all of you probably know better than we do, that's exactly what we're going to need. Just a reminder to everybody, in 1939, President Roosevelt said we need 50,000 planes. And people thought he was crazy, because that was 10 times the amount that we had at the time. And we ended up surpassing the 50,000 planes. So we need to marshal, and we're getting calls all the time, probably like you are, of companies that want to convert over and do masks and do ventilators or component parts or 3D printing or stitching gowns. So, we've got a lot of people that want to help, and we think that that we want the president to use the Defense Production Act in that way. I just want to say one last thing, and this is not to be political, but the president, from all accounts that we're hearing, is considering reopening the economy in 2 weeks. And as you all know, we cannot let that happen. That would be an absolute catastrophe. So you saying, not to be political, but how dangerous that is, it's very important that we hear your voice out in the public saying that as much as you can. And I know you're all doing a great job of saying that, but we cannot let that happen, because we'll be in a hell of a lot worse spot than we're in now. So anyway, please stay in touch with us if there's anything that we can do to help. As these details come more online and become clear, we'll be issuing statements and pushing out the information so you know exactly what's in it. I'm doing a telephone town hall in my congressional district tomorrow, and we will have maybe Brian or somebody from the clinic, Cleveland Clinic, and will be on to help us answer a lot of these questions for people. So we're trying to amplify as well. So thank you, everybody, again, for your leadership. Again, please pass along to your healthcare workforce how much we appreciate what they're doing.
Congressman, thank you for your comments. I think that the biggest thing for all of us, I think we understand the need to sort of follow these stay-at-home orders and do the best we can to disconnect ourselves. I think the idea of anything that you guys can do and you're working on for systemic support to lift the overall sort of, concerns for folks economically, obviously, you look at things like loan relief and you look at those kinds of things. I think if you could reduce some of that difficulty, that will help people feel better about, okay, I'm not working, my business isn't open, but some of my obligations are going to be relieved a bit. And I see that happening in the discussions, and that's so important for all of us.
Yeah, we want to, one thing for me is how do we get these cash payments out as soon as possible? We're trying to bump up unemployment insurance to maybe 80 or 100% for what the worker has. And if we can couple that with, delaying mortgages, delaying student loans, delaying auto payments for a few months, and just till everybody gets their feet underneath them, I think that'll be the best thing, and help on the public health side by keeping people home. So I think we're on the same page. And to the extent you can back us up, we'd appreciate it.
Great. Thank you, Congressman. I'm going to try one more time to see if County Executive Shapiro, I know she's out there. I've been interacting with her on text, but I'm not sure we can hear her. County Executive, you there? Well, I know that she would reiterate the comments that were being made here by others. Her team has been super supportive in this process and leading our efforts to connect the dots across all of our communities in Summit County. So we appreciate you and your team, County Executive, and the support you're providing there. So with that, I want to sort of ask if there was any additional questions. I see through the chat we have most of them here. One more question maybe our health system leaders can help with. There was an individual who said that they had somebody on the front lines who's sort of a health aide that works in their operation that was exhibiting symptoms. Are there ways to expedite testing, or is that just typical advice of talk to your doctor and have them guide you?
Well, right now, with the testing situation, we're only testing high-risk patients that are inpatient. There's very few testing going on right now in the outpatient situation. And that may change in a week or so, but currently that's the case in this market.
Well,
Yeah.
I would add though that we are testing employees who meet screening criteria. So there are specific criteria that have been set up and that we're following for testing employees.
Great. Okay.
Healthcare employees.
Yes.
Healthcare employees. Right. So I know that we probably could ask an additional 50 questions of you all, but you do have the email that I provided before, covid19@greaterakronchamber.org. Please feel free to send additional questions there. We'll do our best to get those back, get them connected to the right resources for that. Tom Smoot had provided some information about PPE, and if you can help there, I saw in the chat that was posted. And again, we'll follow up with folks who are on the call to the email that you registered with to make sure that we get that information out to you. And remember, we've got our website as well with updated information across the community, www.gaccovid19.org, which is also available. We are here to help, so if there's anything that we can do, please let us know. We want to say thank you again to our health system leaders who were part of the discussion, Commissioner Skoda, Tom Smoot, and the others that are on the line, Congressman Ryan, Mayor Horrigan, County Executive Shapiro. We appreciate your support and your leadership in this process, and we will continue to keep you updated. Please stay tuned, and hopefully we'll be able to support each other as we move through this. Thank you all. Have a good day.
Thanks all. Be well.
Bye-bye.